Good afternoon. I'll remind you ahead of time that it is April Fool's Day. I'm not going to do anything to fool you, but was just showed an announcement that came out from Governor Ivey that somebody probably conjured up, saying that all children will have to repeat the same grade next year. I think there are a lot of parents that were dying when they saw that, and then they realized it was April Fool's because they really don't want their children to have to repeat anything. Today I couldn't help but wake up kind of grateful thinking about it's a beautiful day in Mobile, and it's kind of hard to think about that the feeder bands of this virus are hitting us and we can't even see it. And so it's hard to adjust to that, but the only thing I can imagine being worse kind of where we are is that think about it being snowing, very, very cold weather in other places of the country. So we're fortunate that we're dealing with this in the climate that we are dealing with it in. I'm also mighty appreciative of all the people who are praying. Now, there's a lady that comes to the city council meeting occasionally named Velma Jackson. She's very soft-spoken, and she came probably 2.5 months ago, and in her very soft-spoken way, she challenged the mayor and the city council to pray with her, to meet out here on Wednesdays at noon. She was catching a bus to be here by noon of the day, and then she'd ride the bus back to see who would show up. And I had the opportunity to pray with her on several occasions. But she prompts me every now and then to say, Mayor, you know, all of this what we're doing needs to be undergirded with prayer. So I'm grateful for people like Velma Jackson, and I do encourage us all to be prayerful about where we are. So to me, the big kind of conversation this morning has been having to do with the executive order, having to do with the big boxes. So I started off this morning on Schillinger's Road, going to Lowe's, Walmart, Home Depot, then actually went to another Lowe's. But I went in just to observe, to see what I could see about social distancing. And I was very surprised at what I saw, in that everybody in line had at least 6 to 8 feet between themselves. There were not that many people in the store. I talked to the managers, and the manager at Home Depot showed me his cell phone, and he said, Mayor, this is exactly how many people I have in my store. And it was 89. And he said, watch, it's getting ready to change. And sure enough, somebody left and it went to 88. And he said, we embrace your executive order. He said, our corporate headquarters is already, put in place in other cities, the same type of protocols. So we're prepared. And so that was very, very gratifying to hear that. Lowe's was in the process of marking off the people if they have to queue outside to get into the store, to make sure there's the 6-foot spacing there. So all in all, I think that for those who have to go shopping, they're going to find a different experience wherever they go. Now, this really applies to the big boxes and the grocery stores. I had a phone call just prior to this to saying, what about a CVS or a Walgreens? Well, if you just think about CVS and Walgreens, the only place you're going to have anybody close together is at the checkout line. You never see a Walgreens or CVS that's overloaded to capacity or close to capacity. So for those that are shopping in those locations, we just say, self-discipline yourself, work with the store. They will probably insist that you stay 6 feet apart, but the executive order does not apply to the mom and pops and the smaller stores. It's grocery stores and the big boxes. Testing is underway at LAD. This morning, after I left my tour of the big box stores, I met Director Barber at LAD Stadium. He and Chief Doug Cooper, and the tents are in place. The University Hospital personnel are gearing up, and I'm thinking that they're probably there now. So Director Barber is nodding at me that they are on site, and very, very slowly. Today they may test a couple of people to make sure there are no glitches in the system. Tomorrow they hope to do a few more. And primarily they're going to be doing, I'm going to say today, their patients, our first responders, and their healthcare officials. Ultimately, it will be opened up to anybody that needs a test. Ultimately, it will be that anybody that needs a test, nobody will be turned away. Okay? So that's kind of the progression, and Director Barber can speak more to that. In just a moment, I will have him come forward and just talk about what we're seeing trending trending in crime. A little bitty sidebar over here is that we've had some concerns about being able to park downtown while you're getting a takeout lunch. And so we made it free parking from 11 to 1, just to help the restaurants there so that you don't have to pay for parking and pay to get your meal. Yesterday, we rolled out our policy having to do with the Families First Corona Response Act. And in that act, we are explaining to our employees exactly what is in it. It's about a 4-page document. It's online now, so anybody can go, and all the documentation that you need is there. It explains it. And it also explains the Emergency Paid Sick Leave Act. It has that in it, and the Emergency Family Medical Leave Expansion Act. All that's confusing, but it's all in one document. It's pretty self-explanatory for those of our employees that don't understand it. Our Human Resources Department on standby to answer your questions. Yesterday afternoon, on a phone call with all the mayors of the small cities in Mobile County, we were comparing notes, and I told them that we had put out this policy. So we'll be sharing it with them because they don't have access to a Human Resources Department like we do, nor do they have the legal advice like the city does. So we're giving it to them so that they can tweak it for Saraland, Satsuma, whichever, Dauphin Island, whichever of the smaller communities would like to use that. We're going to have a couple of guests today, and I'll call them up at one at a time. So I'll actually start with Director Barber because he may need to roll out and check on some of the on-site testing that we're doing. So, Director, if you can come and just make a couple of comments about what you're seeing in crime, and talk about the testing of first responders and just the overall testing, okay?
All right, thank you, Mayor. The overall crime, we've seen a drop in our calls for service of around 12% or just over 12% in the volume of calls in the month of March as compared to the March of last year. We've seen a reduction in our crime rate of about 9.4%. So even though it doesn't seem somewhat difficult to get our criminals to obey the law, they seem to at least be doing some social distancing. So we're appreciative of that. As far as our testing of first responders, we continue to do that. I don't have all the numbers in today, but I did get the numbers in as of about an hour ago. And so we have 9 police officers and 7 firefighters that are now showing the antibody positive for COVID-19. And so they're still awaiting the PCR test, which is the validation confirmation test of whether or not that virus is actually active. But until then, they have been quarantined until we receive those results. So a total of 16 first responders, and we continue to conduct testing on that. Thank you, Mayor.
Another note, we were having the call with the city senior directors and executive directors earlier, and one of the notes was that we had 2 firefighters that, in the quest of making sure that the fire stations are clean, they knew that a UVC light waved over a table or desktop or clothes, that helps kill the viruses and bacteria and everything. And those units typically cost about $6,000. They went online and bought $1,500 worth of parts and assembled their own UVC light in order to help clean our fire stations, which, again, that's the ingenuity that comes out in a situation like this. So we're tremendously grateful for those 2 firefighters, and I know the other firefighters are grateful because now there's just another mechanism for us to make sure that that the fire stations are clean. At this time, I'd ask Dr. Brian Summerall with Pulmonary Associates to come make a few remarks from their perspective. Doctor?
Good afternoon. The hospitals obviously remain ready. Thus far, we've been very fortunate to not be in a situation such as what New Orleans or New York, any of those cities are like and I stress thus far, and I pray obviously we never get to anything like that. A lot of people who are a lot smarter than me have planned out the curves and the flattening the curves and things like that. And looking at the numbers we may have here, if it holds true, then we should probably start seeing an uptick in cases in the hospital over the next few weeks. Now, once again, that's a best guess, as all of this has been. We're just kind of each day waking up, dealing with what's in front of us and going from there. The one thing that I would back up that Mayor Stimpson said that I agree with wholeheartedly is this city seems to be doing a great job with the social distancing. It is actually pretty impressive compared to like stories I've heard from around the country. So everybody just needs to keep that up. Just because we are not in a situation like those other cities, we don't want to get in that situation. So we need to keep doing this. We want to keep washing your hands, staying away from each other, especially with the new reports coming out that maybe between 25 to 50% of people with the virus never have a single symptom. So you can walk around carrying it and not know. So everyone needs to keep doing exactly what they're doing. Just keep it up. As far as the hospitals go, we are seeing maybe a slight uptick in cases. It is still nothing that we're not prepared for. We are still very, very, very prepared for anything that's going to come in. Testing hopefully is going to get better, as Mayor Stimpson said, over the next few days to weeks. That is still a major obstacle for us as well as the rest of the country. We have a hard time telling exactly how many cases there are because at this point, we're really only testing those that are sicker. And if you go to your emergency rooms, they are going to triage to determine whether you need to be tested or not. They are not testing everyone who comes to the door because we simply do not have the ability to do that at this point. I would urge everyone to take as much advantage of this time as you can. Enjoy being with your families. Make the best of it. We're all in this together. And please know that at the hospitals, we are there for you. And if anyone you know is there sick, they are going to be taken care of.
Earlier today, I was asked, when do you think people are going to really believe that this is serious? Because we still have a lot of people in the community that thinks it's, I don't think by now they think it's a hoax, but they think it just doesn't apply to them. And my comment was, it's almost as if you have to have a personal experience, like you have to have a family member or a friend or somebody that has the disease, they're in the hospital or they've been quarantined, and all of a sudden that light goes on that, hey, this is for real. We can't say it enough that if you've been exposed, you need to stay at home. Challenge is you really don't know if you've been exposed in so many cases because the doctor said, you know, you can be carrying the virus and show no symptoms. So even though we started this off talking about big boxes, the social distancing and all, the better thing is to not even go to the big box, is to stay at home. If any way possible, if you can have groceries delivered, if you can have your food delivered, you as an individual will be better off, and we as a society will be better off. So at this time, I'd ask Dr. Laura Cepeda, the medical director at the Mobile County Health Department, to come give us an update from the health department. Doctor?
Thank you, Mayor. We've got more microphones today. I'm going to need a stool soon. So just want to update everybody today, just where we stand in Alabama. So as of today, our state total for COVID-19 cases is 1,060. For Mobile County, we're at 56. We have 26 reported deaths and 17 confirmed deaths. Sad to report that Mobile County has its second confirmed death from COVID-19. The individual was a male over the age of 70 who did have underlying medical conditions and was a patient in a local hospital. As I mentioned yesterday, on Monday, the Alabama Department of Public Health started adding reported deaths and died from illness on the dashboard. Reported deaths represents the number of individuals who have a positive lab result and are now deceased. But to count a person as died from illness, the medical record of the deceased has to be reviewed by a physician and infectious disease and outbreak staff. So once a review is complete, if the death can be attributed to COVID-19, then the individual will also appear in the died from illness category on the dashboard. So those two numbers usually don't match, but you will see those two start to catch up slowly But reported death totals are cumulative, and those don't tend to decrease. Since Mobile County has passed the 50 number mark, we are beginning to give out some more demographic data, and we have on our information that we put out some information about those patients, including age, gender, race, whether they were hospitalized, and some zip code information available now for zip codes with greater than 20,000 people, because it's not considered to violate privacy. It's just such a small community that we, even a little bit of information in a very small community can be identifying. So we just want to make sure that we protect privacy in a time like this as much as we can, but still consider safety paramount. There's some good news. Everybody can use good news. The doubling time nationally is increasing. It has increased to 4.2 days from 2 days, and we're seeing a corresponding increase in doubling time locally as well. What the doubling time is the time that it takes to see it increase by twofold in the number of cases. So even as we're seeing the testing capabilities increasing dramatically, the number of cases aren't increasing as quickly. So that is really great news, and that doesn't mean, though, that we can cut back on what we're doing. That means that the social distancing is actually working. So that means, again, the message is the same as Dr. Summerall said: keep doing your hand washing, keep doing your social distancing, and with the efforts being to flatten the curve, and hopefully we're making available PPE to first responders, healthcare workers, and everyone who's trying to take care of the sick, and spread it out so that the hospital availability is there for the people who get very sick. In terms of hospital usage, the beds in the county, both the ICU beds and the regular beds, it's only about 40% full, so we are doing well in that regards. And ventilator usage is still about 50%. So we're doing well in terms of keeping those resources available for the sickest patients. We are still investigating and providing recommendations for the cluster of respiratory illness in the local correctional facility and long-term care facility. So that is ongoing as well. And that concludes my report today. Thank you, Mayor.
Thank you, Dr. Laura Cepeda. The statistics, some of the statistics that she was referring to, as we get better, the Mobile County Department of Health and the hospitals, and we've been inputting the information, but as we start to develop trend lines, then you can start to use that data to make better decisions. And I think that now, after about 3 weeks of having collected data, that we'll be able to start really using it to make better decisions with. So at this time, though, I'd like to change directions and call on Terry Harbin, who's the market president for Bancorp South. Terry?
Thank you, Mr. Mayor. Appreciate your proactive leadership during this time very much. The mayor asked me to speak today about the two major programs that the SBA is rolling out. They are both designed to try to protect from job loss. So this Friday, we will have the Payroll Protection Program loan available. That loan, very simply stated, is a loan made to an individual company, less than 500 people, to be able to maintain people on their payroll or recall people back that they have already been forced to lay off because of the corona situation. So those loans are available, and it is in an amount equal to 2.5 times your average 1 month's corporate salary. So think about that. If your regular salaries every month run $10,000, you can get $25,000 in that loan. This loan is forgivable by maintaining or recalling those people to the workplace. It's pretty detailed in terms of the calculations, so I'll be available afterwards to answer any questions on that. But that simply is the payroll protection program loan. The second, and that is through any local bank that is an SBA lender, so available pretty broadly in Mobile County. The second loan is an economic loss disaster loan. This loan is made directly from the SBA to the company. These loans are significantly larger, and they're loans that are not forgivable, but they amortize over a period of time. And this loan, you go directly online to sba.gov and you apply for that loan there. If you need any help, local bankers are more than happy to confer with you to help navigate through that form. But those are being 100% guaranteed to the banks, and so they will make that loan readily available to businesses. It's for any economic loss that's non-payroll. Be glad to answer questions about that afterwards. Thank you very much, Mr. Mayor. Hope that's helpful.
Thank you, Terry. You know, today with all that we have going on with the coronavirus, if that wasn't happening, there would be a whole lot of focus on National Census Day. You know, the census is going to go on, and we have got to be counted. So in everything else that you're doing, if you have received a census form in the mail, you need to make sure that you fill that out again so that we can be counted, and there will be constant reminders over the next few months about doing that. There's actually a big banner right to my right, kind of around the corner a little bit, that reminds us, you know, you need to be counted. Ask if there's any questions for me or any of the guest speakers today.
Mississippi both have put in or are planning to put in shelter-in-place orders. I know the governor has not done that yet. Are you guys? I know you guys have a curfew, an order ready in case you guys decide to do that. Is there a reason why you guys still don't really feel that's necessary for the city of Mobile?
Yes, and as we look at the numbers and we talk to the other mayors in the city, in the state, we decided that it's not, at this point in time, the prudent thing to do is to do a shelter in place. Yep. And I'll repeat the question from now on. Yeah.
Other agencies are paying hazard pay for the first responders. My understanding is that the city of Mobile is not.
Yes. So the question is that there's some agencies that are doing hazardous duty pay for our first responders, and if the city, do we have a plan to do that? And the answer is yes, that we are reviewing that as we speak. And in the next day or so, in the next 48 hours, we'll be coming out with what our plan is.
Is there a reason why it hasn't been happening?
Yes, because we've been focused on trying to get the testing. Director Barber, who would be typically leading that direction, has been consumed by working with all the hospitals on testing. Yep. And that's why we haven't done it.
We recently lost, or today we lost our second person from Mobile's coronavirus. It was just last week that we were actually talking about the first victim. Have you spoken to the family at all of this victim? And also, do you think that us losing a second person kind of speaks to the severity of just how dangerous coronavirus can be?
The question is, have I spoken to one of the family members of the deceased to the coronavirus? And do I think that that's kind of the wake-up call that some people need? And the answer, that's exactly what I was saying, is that unfortunately, something tragic has to happen to wake up some people. That's obviously very, very tragic. This morning, one of the people who is deceased was a friend of mine, actually grew up in Mobile but living in Baldwin County. Could have been counted as Baldwin County death, named Tim Gaston. And I called Tim's very best friend and told him I know he's lost his best friend. And I asked him for Tim's wife's phone number, okay? And I know that at this point in time, I have the ability to reach out to individuals, and hopefully I won't have to make many of those phone calls. But that's my inclination, is to do something like that when I have time and when I have the contact information to express my personal condolences as well as the city's condolences. Yes.
Does the city or the grocery stores in particular know what their fire limit is?
Yes. The question is, does the city or do the grocery stores know what their limiting capacity is according to the fire department or to the codes? The answer is yes. The fire department knows every single building. This morning when meeting with the managers of the big boxes, I gave them Chief Lamey's contact information. Some of them already knew what their capacity was. Typically, when you go into a building, somewhere in their documentation that's put on a wall, it has what the maximum capacity is. You really see it in restaurants a lot. And so all they have to do is call the fire department, and they can find out what the capacity is.
Yeah, I will say I did call the fire department yesterday asking for an example of a business, and it was not readily available, and I was told it wasn't
Yeah.
going to be in that moment.
Well, the comment was that the comment was made that he'd called the fire department yesterday, and that they said that information was not readily available. I'm hoping if you call today that you'll get a different answer, because I called them this morning. Okay, so
I was trying to get an example for a store that we were going to be standing outside of.
yeah, and so I know that it's like a lot of things we're learning as we're flying this airplane, and so now I think they'll be better prepared to answer that question. Yep.
With
Yeah.
16 first responders, city employees now having the antibodies, being tested positive for the antibodies, have you or Chief Barber or anybody in the executive team been tested? Or do you think that that's necessary at this point?
I haven't felt bad. I probably should be tested, but I have not been tested at this point. And I'd say that, yes, we need to be tested. Yeah, and we will be. Just hadn't done it yet.
Okay.
Hey, Stimpson, I'm not sure if this is for you or for the health department or for kind of a combination of both, but in Mobile County, we only have 7 zip codes with populations of 20,000 people or more. As a matter of fact, our station is kind of over in the Midtown area and east of 75, and pretty much all of Pritchard, that's all under 20,000 people in those zip codes. What's being done to warn them, or do you think that that's enough information going out to people?
So the comment is, are we really getting enough information out to all of our population? There's some of the areas of the city that have smaller populations than other. I don't think that we can ever say that you've gotten enough information out to everybody. There's some people that really just don't watch TV. There's some that are not on social media. And, remember that not having a daily newspaper is certainly detrimental to the communication, especially when you have a crisis like this. So with the limitations that we have, I think that we're probably doing a good job. But if somebody knows a way that we can do a better job reaching out, we'll certainly do that. There are other agencies that are communicating within their network, not just say the Boys and Girls Club. There may be some people who are members, those children are members, that they have their network of how they communicate, big brothers and big sisters. So a lot of the agencies, Penelope House, all of them are probably doing something to communicate. I can't imagine that we have very many people that don't know that there's a crisis going on, but if I find out otherwise, we will adjust, and I'll ask Dr. Cepeda. She's probably got a better answer than I did. Yeah.
Hey, let me speak to that a little bit. So if we have those addresses and we can map the addresses of every individual, and so within those communities, if it starts to look like there is a cluster of positive cases and not just a random scattering, then we'll actually investigate that and, as a cluster and proceed as necessary from there, okay?
Even though those people may not be, bigger than 20,000, they will still get information if they need it.
Absolutely. Yes, absolutely. So it won't just, if it looks like, hey, this is one neighborhood, that's a hot spot, that will be addressed.
I know you said that they're in the 36695 zip code, that's more than 20,000 people. I actually live there. 13 people have tested positive in that area.
Mhm.
Is that should people be concerned that that's a cluster type of thing? Human, people like sharing with each other, like community spread. There's the word. Should people be concerned with that? Should people not go to the grocery stores in there? Because that's over in the West Mobile area. That is a heavily populated area right near Hillcrest and Cottage Hill.
Right.
What should people know there? Is that, is it spread? that area? Or
So
is it people with
the question was that he lives in the 36695 zip code, and that there are a lot of people there, and that is the zip code that has the highest number of cases right now. But it's just like you said, that area is heavily populated, and so when you see the highest number of cases, it has the highest number of people who live there, and so we're not seeing a cluster among a certain small area. It seems to be just a reflection of the highest population, and so therefore, because just random spread, not a true cluster, but just because they're the biggest number of people there, a reflection of the highest number of cases.
besides social distancing, should people do other things to be trying to limit that spread?
Stay home.
No, wash your hands, stay home if you can, social distancing.
When you identified two clusters yesterday, one was the corrections facility,
A long-term care facility, yes.
are you seeing more cases show that those two clusters are identified?
Not at this point. We're just actively investigating that and giving our recommendations as that continues.
On the information that the health department gave out today,
Yes.
as far as hospitalizations, number of patients from the sample size of 50,
Yes.
there were 12 hospitalizations and then 16 that were unknown. Can you explain what unknown means?
Yeah, so the question was about the demographic information that we're now giving out. There was a listing of hospitalization or hospitalized, and there was a yes, a no, and an unknown. There were 12 hospitalized, 24 not, and 16 unknown. And the question was, what does the unknown represent? And what that represents is just people that we've not been able to investigate completely yet. So we're just, limited people resources as well. And so we just haven't been able to follow that up entirely yet.
Do you have the age range for the people who are in the hospital?
I don't have that at the moment.
Are they older? I mean, you don't have that at all.
I don't have that. Now, in general, this is an older, but I don't have that for Mobile County at the moment.
Speaking of those, the two people who in Mobile County have died of coronavirus,
Mhm.
they appear to be both men. The first victim, 66-year-old man with underlying conditions. The second man,
Mhm.
more than 70, also with underlying conditions.
Yes.
Does this necessarily show that coronavirus hurts men more than women, or the older people, or does this kind of say anything with both the victims being male and also of similar age?
Oh, that's actually exactly what the statistics have shown, that men are at a higher risk, and that the older you are, the more at risk you are. And if you have pre-existing conditions, you are more at risk for morbidity and mortality from this disease. So that falls directly in line with what we've seen actually across the world and nationally.
Obviously, there's a good thing and a bad thing to this question. With the fact that the report out 25 to 50% of people are asymptomatic, that's very
Yes.
bad for spreading it.
Right.
But that's also maybe good for the numbers of people who are getting, maybe they're not actually getting sick with it, so that means the percentage of the people sick and the percentage of people dying are a lot lower than what's being reported. Is that fair to assume? Obviously, it's very bad that those people are asymptomatic because they can still pass it on.
Mm-hmm.
Correct.
Right. So give me your question so I can repeat it back.
Is it a good thing that a lot of people are not actually getting sick from this, 20 to 50%, 25 to 50% according to that report, or is this still a very bad thing?
So the question is it good that people are not getting sick, 25 to 50%, that are showing some antibodies, at least in some of our first responders? That's what we're seeing so far. You can look at anything and find some good and some bad. So what you could say is good from that is that those people are getting immunity, because this is probably not something that's just going to hit us once and be gone. It's probably going to cycle through, annually or on some cycle. We don't know that yet. And so those people will probably have some level of immunity. Those people may be able to go back to work and be less at risk. But what's bad about it is that that's why this virus is hitting us so hard, because normally if you have something that can be deadly, you feel pretty bad, right? And so you don't need to be told to stay at home and social distance because you feel terrible. You know, you're sick, you're home on your sofa with your feet up. So this is different in that respect because you have to be told or you have to be tested in order to get that information. And so that's why it's so easy to transmit to the people who are vulnerable. Okay, that's why the message has to be so strong that even if you feel okay, and especially if you feel okay, you can't just ignore that and get out and do your normal things. Because the people who are at risk are the ones that we're trying to protect. Thank you.
So our hope is that every day that we do this, that you go away realizing that there's a lot of good things going on in Mobile, from the ingenuity of trying to address some of the problems to collaboration with our healthcare providers. And so I would just say continue to do the things that you're called upon to do differently than what you've done in the past. Wash your hands, social distancing, stay at home, and pray. Thank you very much.